Welcome to Slocum Center for Orthopedics and Sports Medicine. My name is Dr. Koester, and I specialize in musculoskeletal injuries, concussion management, and pediatric and adolescent sports medicine. In this video, we will be discussing sports medicine safety. The first aspect in developing sports medicine safety is to look and see what kind of program your child is involved in. That program should have coach instruction. That instruction should include CPR and concussion training. And the coaches should really have a plan in place of what they should do in case an athlete is injured. Common injuries in sports medicine, primarily in youth, include knee and ankle injuries. We certainly see scrapes and bumps and bruises, but knee and ankle injuries are the most common, particularly in sports like football and soccer and basketball. When it comes to softball and baseball, then we tend to see more elbow and shoulder injuries. In soccer, football, basketball, most injuries that we see tend to be acute injuries that come on just by one twist of an ankle or getting hit in the knee. Whereas softball, baseball, swimming, those sports tend to present more with what we call chronic injuries or overuse injuries, where doing a repetitive activity over time will lead to increasing pain. You should seek out a sports medicine doctor whenever your child complains of pain that either lasts for more than 3 or 4 days or keeps them from participating in either a practice or in a game. Bumps, bruises, a little bit of achiness and soreness is really normal with sports participation, but if it's something that interferes with their ability to walk, for instance, if they're limping, or if their arm is too painful to swim or to throw, then we need to see that. We need to see that child and take a look and see what may be going on. It's pretty unusual for just a mild injury to result in that type of loss of ability to do the sport that they enjoy. Sports injuries are best diagnosed by getting a full history, understanding what sport the person is doing, understanding how long they've been doing it for, looking at patterns of practice, looking at patterns of how many games they've been playing, and really getting a good fundamental understanding of what's been going on in that person's life for the last several months. Making the most accurate diagnosis then involves a good, solid, thorough physical exam that may include doing x-rays, and in some cases may include doing CAT scans or MRIs, but the history and the physical exam are really going to be the keys to figuring out what's going on and then coming up with a treatment program. Treatment of most sports medicine injuries is going to involve a combination of several things. Oftentimes it may be as simple as resting for a day or two, icing, using some anti-inflammatory medication. Oftentimes, though, it may include changes in technique or how you're performing that activity, and often will include physical therapy as well. Of course, it depends upon what the injury is, of what the exact treatment is going to be, but there may be a variety of things that are put into place that will help you get better and get you back inactive quicker. Oftentimes, we'll put physical therapy in place to not only make you stronger, but to decrease risk of injury happening again. Rarely are you going to come in and we're going to look at you and say, stop doing what you're doing for 6 weeks and then start back again. The essence of sports medicine is making you better, figuring out what exactly is going on, but also keeping you active. Rest is needed sometimes, but rarely is rest the only treatment. We really want to look actively at figuring out what caused the problem and then putting measures into place to not only make you better, but to keep that problem from occurring in the future.